Hi, PsyQ community. I'm Dr. Miranda Fisher, Medical Science Liaison at Otsuka Pharmaceutical, and I am here today again with Miss Laura Kaponer. Laura is a certified peer support specialist, a mental health advocate, and a blogger, and she is working with us on an 8-part podcast series where we really get to gain her perspective on a variety of different mental health topics. So thank you so much, Laura, for being here.
Thank you for having me. I appreciate it.
Absolutely. So today's discussion, we're going to talk about the importance of mental health professionals. So Laura, do mental health professionals experience stigma? And if so, what are some of your experiences?
Absolutely. I didn't fully realize until I got involved in the mental health field as a peer support specialist that I had been out of work for a while. And when I told somebody I had a job, oh, they're very excited. And when I explained it was in the mental health field, a frown came upon their face and they kind of said, "I'm sorry," as if it was some kind of punishment or a last resort option. What's interesting to me is anybody that's in the service field, like medical professionals or ambulance or firefighters, there's this sense of pride of thank you for what you do for the community. So why are mental health professionals not included in that? They deal with a very difficult population and they're working with something that is very misunderstood, the brain and brain disorders. So why are they not held to the same regards as everybody else in the medical field? It's unfortunate. I think they're kind of the unsung heroes of service people in the community.
Yeah, absolutely. So how can patients as well as caregivers help to address some of the stigma that's faced by mental health professionals?
I think what's fantastic are advocacy and educational organizations such as PsyQ, kind of giving an insight into the challenges. Yes, people that have mental health conditions face a lot of challenges, but so do the people that serve them. There's something very common called compassion burnout, where mental health professionals can kind of internalize some of the things that are going on with their clients. Or maybe when they, clock out for the day, they don't mentally clock out with everything that's going on. There's a lot of stress that they bring home with them. I think asking questions. What do you do for a living? What does that involve? Education, as always, knowing what a person goes through to become a mental health professional, the degrees, the studying, the certifications, asking them how their day has been and some of the challenges they face at work, and truly having an open mind to discuss that with them. Also realizing a service professional is a service professional. They're all providing something much needed to the community.
Yeah, well, thank you so much for sharing your perspective today. We really love having you on our podcast series. And so again, just a reminder to the audience to please check out our patient and caregiver section and keep an eye out for more podcasts with Laura. Thank you so much for listening.